Hi, it's Jamie, and we're going to be answering two questions today. The first one being, how can we integrate recreational therapy into the existing activities department? And for that, I would use an example, which I already did this activity for my people, which is bingo. So, bingo is just a normal activity on its own, but how can we go ahead and integrate recreational practices into that bingo? So, the first step I would say is to know your audience. So, who are the elderly people and patients that are participating in this activity? What are their needs? What are their issues? What could they work on? So, for this example, let's just say that we have people with some motor issues. So, they're having it hard because of, let's say, arthritis to really move and go on with their normal day activities. It's harder to brush their teeth, pick up things. So, I would say for bingo, which is a normal activity, we could use chips, bingo chips, so that they can practice actually picking up and holding the chips as opposed to just using a paper and, pinching or putting the numbers however they do with the paint stick. We're going to use chips so that they can go and focus on that. That would be first step was, just picking out our people, what can they do, and then applying that through an evidence-based practice. Now that kind of takes me to the next question, which was what is the importance of distinguishing ourselves as recreational therapists instead of just like normal activity planners and whatnot? I think that was the question. And to that, I would say, yeah, we use evidence-based practices. Normal people will just give you an activity and be like, yeah, it works. But recreational therapists really hone on using research and evidence whenever it comes to integrating their practices into the whatever they're trying to help with. So yeah, basically, pick out something that's going to work for your people. So figure out what these people's needs are. And like I said, I would say that for mine, it was motor skills. And then really use evidence-based practices to figure out how you can help these people.